Okay,
There we go.
I appreciate everybody coming out this morning. This is our NTALF continuing series of programs that we put on at North Richland Hills Library. Today we have Louis Lamar, Jr., Senior, I'm sorry, with Physicians Mutual, and Catherine Dubois with Physicians Mutual. They're going to talk to us about Medicare. Thank you.
Oh, thank you. Let's see if we can get this party started. I am not sure if that's, we didn't get a chance to enter all of your names and all of that, so please forgive us. They're kind of setting the stage for what we're going to talk about today, because we assume that people know very little about Medicare, so we kind of start at the ground level, defining Medicare and its parts, talk to you about enrolling in Medicare, you know, how will you pay for health care when you retire, and we talk about that transition period when you're from that employee to retiree. And this young lady up here is so far away from it that it's ridiculous. A mere babe. She just happens to be an attorney, which is why she's here. But I know when I first saw her, I said, man, I don't know what fountain she's been drinking from, but I want some of that. But I didn't know at the time she was not a senior. If she's a senior, you know, I don't know. But anyway, have a little human. You know, Medicare is a federal health program that's really designed for seniors. It doesn't say it up here, but established in 1965. It's often confused with Medicaid. And Medicaid and Medicare are two different programs. Medicaid is, without going into a lot of detail, is primarily for lower income individuals. Most people who are on Medicare couldn't qualify for Medicaid because of income limitations, okay? And now, most people think of Medicare as simply being for seniors, but younger people with certain disabilities can also qualify for Medicare as well, okay? It does say that. It was created to help pay medical bills in 1965. Centers for Medicare Services is what CMS stands for. The Medicare Modernization Act of 2003 was really when the Medicare Select Plans name was changed to Medicare Advantage Plans. They're going to, I think in this presentation, it's been a while since I've run this presentation, but I think they're going to talk a little bit about the MAs. If they don't, I'll come back and tell you. When I say MA, I'm talking about Medicare Advantage Plans, okay? If it doesn't, I'll come back and we'll talk about it. The Affordable Care Act came along in 2010. And we'll talk about what that does for seniors, and I think you'll begin to see that the AFA has a lot more benefit than most people have been led to believe. It's not that monster that a lot of people think it is. I don't know if you all have gotten your Medicare and You booklet yet, but it's about a 1/4 inch thick, 3/8 of an inch thick. It's chock full of information, comes from Medicare, and no, that's not it.
AARP sent another form of admission.
AARP does not have anything to do with the book I'm talking about. This comes from Medicare. This comes from Medicare. It comes from the Centers for Medicaid Services. CMS sends this out to you. And the Choosing a Medigap policy booklet, this is the booklet they're talking about. This also comes from Medicare. Let me back up here. Don't confuse AARP with anything that I'm talking about today.
What about all the stuff I get from them about Medicare?
Don't confuse AARP with anything that I will talk about today. AARP is just an agency.
Okay.
It's a private agency, has absolutely nothing to do with Medicare from an official standpoint. Okay, no more than we do. That's Physicians Mutual. Okay, they basically, AARP was basically started out to try and protect the rights of seniors, and now it's evolved into a lot more things and money-making ventures and whatnot with other insurance companies, but it has absolutely nothing to do with Medicare. Nothing. Okay. Now, what are the make up original Medicare. Part A, for those who have got 40 quarters or more, is free. Doesn't cost you anything, you get it automatically. Part B, you've got to register for that. You've got to enroll in Part B. Part B is something you pay for, and currently the rate of the premium for Part B is $99.90. I just tell people $100 a month. But with the dime today, you can't get a cup of coffee anymore for a dime. Starbucks will laugh at you when you come in and start talking to them about a cup of coffee for a dime. You know, like, what planet? You must have been in a time warp. You've been in a coma somewhere for years. But Part A and Part B comprises what's called original Medicare, and the two of those will actually pay for about 80% of your medical expense, okay, hospital and doctors combined. That 20% portion is still your responsibility. Medicare Part C, this is a thing they call Medicare Advantage plans. I don't know why they even use the term Medicare, because MAs are really private companies who have contracted, and in your little booklet there, that's that the Medigap booklet? Yeah. If you turn to page 50, turn to page 50 real quick. I'm going to take you through something here that you probably haven't had anybody share with you. Turn to page 50, and on the upper right side of the page, you see Medicare Advantage Plan. Would you read that, please? And
Sure. A type of Medicare health plan.
whoa, a what?
A type.
Type. Okay, I just want to emphasize that.
Okay.
A type.
Of Medicare health plan offered by a private company.
What kind of company?
Private.
Okay.
That contracts with Medicare.
What's the relationship?
It's a contractual.
It's a
relationship
contractual relationship, okay?
to provide you with all your Medicare Part A and Part B benefits.
Benefits. Remember that. Part A and Part B benefits. Okay, continue.
Medicare Advantage plans include health maintenance organizations, preferred provider organizations, private fee-for-service plans, special needs plans, and Medicare medical savings account plans.
Now this next part is going to be really important.
If you are enrolled in a Medicare Advantage plan, Medicare services are covered through the plan and aren't paid for under original.
So your
Medicare
services are covered where? Through the plan.
plan.
And are not paid for under original Medicare.
So you relinquish that, your original Medicare, you're handing it all over to an HMO.
They contract with Medicare.
Uh-huh. Okay.
That's why I'm having you read it, and that's why I'm
Oh, yeah,
emphasizing
this is
certain
good.
things. See, and who puts this out? Who
CMS.
puts this publication out?
CMS.
Yeah.
Medicare publishes this. So this is not Physicians Mutual material.
Mhm.
This is third-party influence,
I looked this in.
okay? The point I'm trying to get us to focus on and understand here is that if you are a part of a Medicare Advantage plan, this is what we call the privatization of Medicare. Original Medicare, silence your phone please. The original Medicare plan is covered by Medicare. Okay, Medicare Part A and Part B, that's under the original Medicare plan. Okay, Ms. Denise, you with me? Okay, but I wanted you to read that from here as opposed to me just verbalizing that to you because, well, he said this, he said that. No, she read it straight from the book. And this is where the information comes from. So we got to add some credibility to the information that we disseminate. And what better source than the publication from Medicare itself? Okay? All right. Now,
So are you going to get more coverage through an Advantage plan than under the original, than under a Part
we're going to
A
talk
or B?
about all of the coverages and all of that. I want us to
Okay.
understand the source. I want us to understand the source right now.
I got it.
We got to go through a lot of stuff here. We're talking about the parts. Prescription drug coverage is Part D. Okay? That was also a part of the Affordable Care Act. Some more money was tied in to help try and close the proverbial donut hole. Okay? Now, this is considered a health care pie. Y'all are sitting way back. You probably should be a little closer. But when we look over here on the healthcare pie, when you go to your doctor under your original Medicare, I think I'm going to digress here and say something about, because you raised a question, and I'm going to partially address that now. Under the Medicare Advantage plans, as it says in the book, it provides you with your A and B benefits. So as far as more coverage is concerned, there's no more or less here. It's going to provide you with your A and B benefits, but the real problem or the real issue that we need to concern ourselves with is it says they operate like, and if you look on page 7, I believe it's on page 7, it says they are like an HMO or a PPO. 7, go back to the front of the book. They operate like an HMO or PPO, which means that you are in a network, okay? A network means that you are restricted geographically to a particular part of the country. When we look at it, and the way I like to explain it to people, if you have a large backyard, you have a dog, the dog is on a leash, how far can the dog go that's on the leash? As far as the leash will permit it to go. Okay? That's the MA. It's operating within a prescribed region, a prescribed area. Okay? Whereas if you have another dog in that same backyard that is not on the leash, that dog has the benefit of the entire backyard. That's original Medicare. Now, my question is very simple. If you could digress and become the dog, which one would you rather be? On the leash or have the full range of the backyard? And most people would rather be able to run all over the backyard and enjoy the backyard in its entirety. Now, the other thing that a lot of people don't know about MAs is that you are restricted to their pool of doctors. Your doctor may or may not be on their approved list. And if your doctor is not on their approved list, you can no longer use your doctor unless you pay out of pocket. Okay? Also, you have certain hospitals that they are affiliated with. And if you have a medical emergency and you're right in front of, say, John Peter Smith, and John Peter Smith is not a part of their network, cannot go in there unless you have an ER event, and you got to go in there and pay for it out of pocket. Okay? These doctors also that associate with MAs, they have an agreement with the MA to treat you according to a prescribed plan of treatment, which may or may not be what's medically necessary. So you're looking at what quality of care am I really getting from the Medicare Advantage plan? And if I travel very much, do I still have the same coverage that I would have under original Medicare? In most cases, you would not. You say you want to go to Atlanta and visit family, or for whatever the reason, or you could even go to San Antonio for that matter, or Houston. You know, you're out of network, you have a medical emergency, now you're at the mercy of ER because that's where you've got to go. Okay? You can't go to a specialist unless you are referred to the specialist if you are associated with an MA. The reality is MAs place certain limitations on the coverage that's available to you that you don't have to deal with when you're dealing with original Medicare. Okay, we may come back and say more about it, but I just thought I need to digress and deal with that right now. Because here, when you go to your doctor's office with your original Medicare card, and if you had a supplement to go with that, you would end up paying nothing to your doctor. The same is true, here, Medicare does not cover dental coverage, you don't have vision coverage, so that's a gap, if you will. And we're talking about the areas here that you need coverage in. You don't have dental coverage under Medicare, and you don't have it on the MAs either for that matter. And you'd have to do something about this. This has to be taken care of through another source, so that's a gap. Pharmacy, you got to take Part D, take care of that. And when you go to your lab diagnostic, that will be taken care of under, you look at an 80-20 thing under Medicare. And your outpatient the same way with hospital here. Currently, when you go into the hospital now, it's $1,156 paid by Medicare, and your plan, your Medicare supplement would pay the other $1,156, and you would end up paying nothing out of pocket, okay? Durable medical equipment is also covered. But now, when we get over here in the home health care, adult daycare, assisted living, and custodial nursing home, intermediate and skilled, you will find that you don't have coverage over here under Medicare, and you don't have coverage over here on the MAs either, okay? On the Medicare, the best you're going to be able to do here is going to be 20 days of skilled nursing care, and beyond that, it's on you. Medicare was never designed to pay for everything. It was never designed to provide nursing home care. Okay? We can get into a lot more of this in a one-on-one. Obviously, in a presentation like this, there's only so much material that we can cover. But this side of the healthcare pie is basically exposed. And if you don't have, I call this asset preservation. If you don't have some kind of long-term care vehicle or some kind of home health care vehicle in place, you will find a rapid erosion of your estate. You may have a nice 401k sitting over here with $300,000 or $400,000 in it, and it seems like, okay, I've got enough money to last me for the rest of my life. But when you start paying $40,000, $50,000 a year, which is on the low side for nursing home care, most of the home health care agencies today are charging anywhere from $20 to $25 an hour. And if you just think of 4 hours per day, it doesn't take long to do the math to see that the money will go rather quickly. And this is where I said it's wise to use leverage. Leverage being to use OPM, other people's money, to do for you what you need to have done. And you can do that with a premium. And with the premium, you're paying a portion, a very small portion of the actual cost to provide a large pool of money. That's essentially what insurance does. And I use the term leverage because that's really what it is. This is why people wonder why real estate investors get so rich. Well, a real estate investor can take $100,000 and control $1 million worth of real estate. It doesn't take an Einstein to figure that out. If I can do that time and time again, I got $300,000, now I control $3 million worth of real estate. Well, once my equity gets to a certain point, I can cash out. I've got my money out of my pocket, and I've still got the equity that's continuing to grow in the real estate that I hold. Does that make sense? And that's essentially what I'm talking about with Medicare. I mean, with a long-term care plan, a home health plan, any of those kind. Adult daycare is becoming very big. Matter of fact, in my neighborhood, a daycare has recently closed and was renovated, and now they're reopening as an adult daycare center. So it's because baby boomers, baby busters are living longer, and many people don't want to put mom or dad in a nursing home when I can take them to an adult daycare center, leave them there while I go to work. I come back. It's just like taking kids to a daycare. Come back in the afternoon and pick them up and take them home with me. I can't leave them home all day because they may not be able to fend for themselves. There may be a little bit of dementia going on. There may be other reasons why I can't leave them there. I know I went through this person with my own dad, and dementia was a real issue with him. And obviously he had to be in a facility that provided some sort of care for him 24 hours a day. And I had an aunt that really ostracized me for that, but once, because she didn't know, she didn't understand. But when later on, a few months passed, and she came to the realization that, it wasn't that I was being mean, he just can't stay by himself, and obviously he needs to be in an environment where someone can provide that kind of care. But these are some things that you need to be concerned about. If you don't have this area covered, that is an exposure, and you can see that comprises almost half of the healthcare pie. Final expenses, when we get over here, Social Security pays $255 for death benefit. We know today that the cost of living has grown to such a point that $255 will not even open and close the grave today. It really will not. I mean, to open and close a grave in most modern cemeteries, you're going to be looking at a minimum of $800 up just to dig the hole and put the liner there and to put the casket in the ground. It's going to cost you, let's just say $1,000 just to do that. So $255 doesn't go very far. And if you don't have this taken care of, your final expenses taken care of, that's something that you certainly need to give some serious thought and consideration for. Okay? Part A benefits. You're in the hospital. This is a Part A now. We're going to deal with the parts, because we said we're going to deal with the parts. $1,156 is the deductible going here. Medicaid will pay 100% for the first 6 days, and then after that, $289. Then it just breaks it on down so that This is for an extended hospital stay. Now, you'll notice here, past 150 days, Medicare doesn't pay anything. Now, if you stay in the hospital past that period of time, rigor mortis is right around the corner. Okay? Let's be real candid here. Rigor mortis is right around the corner. Because today, seriously, think about people you know going to the hospital. If they're in the hospital longer than a week, they're in a serious situation. You may be in ICU for 3 or 4 days, and you come out, and a lot of hospitals call it step down, which moves you to a private room. You may stay there for another week or 2 weeks, but very seldom do you find people staying in hospital beyond 2 or 3 weeks. And in those cases, they're in pretty bad shape and stay there that long. Okay? So we're talking about Part A benefits. Okay? This is still on the Part A. Skilled nursing facility care. You must meet Medicare's requirement. You must be in a hospital for at least 3 days, and then you transfer out of the hospital into the skilled care facility within 30 days after leaving the hospital, and you have to be showing signs of improvement. You have to be on the uptick, okay? Medicare pays 100% for the first 20 days. That's what they just talked about, okay? For the first 20 days. And after that, you'll see that their portion begins to diminish, then it's on you. It's really on you at that point to begin picking up the tab. But as I said earlier, Medicare was never designed to provide nursing home care, home health care. That's not the purpose. It's medical care primarily is what it's designed to do. Okay. Additional benefits on Part A. Medicare does not pay anything for the first 3 pints of blood. After the first 3 pints of blood, it'll pay 100% for everything thereafter. But for some odd reason, the first 3 pints of blood, that's on you. And if you have a Medicare supplement plan, it will pick that up for you. Okay? Hospice care is also covered under that as well. And incidentally, on that same subject, MAs does not provide coverage. Most of that I know of do not provide coverage for hospice care. MD Anderson is the premier cancer treatment center in the country. They do not accept anybody's MA. I don't care who they are. MAs are not accepted at MD Anderson. The Baylor Cardiac Unit does not accept MAs. There are a lot of other places that do not accept Medicare Advantage plans. So, when people talk about the advantages of it, there are huge disadvantages of Medicare Advantage plans as well. And with cancer being such a prevalent problem in society today, we got breast cancer, uterine cancer, cervical cancer, prostate cancer, colon cancer, just a whole plethora of cancers out there today. And with all the things that spring in our food, you got all these steroids and all this other stuff. There are more and more instances of cancer cropping up today than there was 20, 30 years ago. And I think a lot of it has to do with our diet and the things, the pesticides and all of the various other chemicals that are added to our diet. Okay. Part B. This is a part here that's new. This is the wellness exam, the Welcome to Medicare physical exam. I think they've come to realize it's much easier to keep a person well than to get a person well. It's kind of like preventive maintenance on the car. You buy a new car and you start out on a good maintenance plan. Typically the car is going to run better, longer than if it's neglected. And the same is true with our bodies. Okay, so they want you to go in and they will give you a complete exam, and certain preventive services are there, inpatient, outpatient doctor services, surgical services, supplies, you get some speech and physical therapy, they run diagnostic tests. Durable medical equipment, I think we all know we're talking about wheelchairs, walkers, crutches, things of that nature. We're talking about durable medical equipment. And certain ambulance services are available on Part B. This Welcome to Medicare exam, initial review of your health, receive education and counseling about preventive services. And this has to be done within that first 12 months once you go on Medicare Part B. It's an annual benefit that you enjoy. It doesn't cost you a thing. You go in, the doctor does a complete head-to-toe exam, and that's a part of that Welcome to Medicare exam. And from that point on, it's considered a wellness exam. Okay? And they help you devise a personalized prevention plan. And again, see here, it's available every 12 months, not subject to the deductible. Okay? Now, Part B. Part A, you don't pay anything there. Part B, you've got $140 annual deductible. After you pay the deductible, Medicare will pick up 80% of all eligible covered charges and 100% of all of your covered clinical lab services, and then varying amounts for covered preventive services. Now, Medicare approved charges is really just a nice way of saying this is all Medicare is going to pay. So most doctors and hospitals understand that, and usually don't have a lot of issues with excess, what they call excess charges. You don't have, and if you query them up front and get that out of the way, you know, that's not usually an issue. Okay. Part A, you're automatically enrolled for Part A when you're receiving Social Security benefits and you turn 65 years old. Talked about that earlier. If you're not taking Social Security and you're 65 years old, you need to sign up for Part A by contacting your local Social Security office. Okay. You need to sign up for Part A. You can sign up during the original enrollment period, general enrollment period, special enrollment period. If you don't buy it when you're first eligible, your monthly premium may go up 10%. I wouldn't worry about that a lot because you're going to receive your little red, white, and blue card 9 times out of 10 is going to be done automatically. If you haven't received it by the time you turn 65, contact Social Security and get that taken care of. Okay? Now, Part B. You get your Part A automatically. Part B then is something that you need to sign up for. If you don't sign up for Part B when you're first eligible, you must show proof of having been covered by credible coverage during the period of time in which you were first eligible and the time you eventually sign up for. If you do not show proof of coverage by credible coverage, then you're going to have to pay 10%, a 10% penalty for not having signed up for it. Okay? And you don't want to get stuck with that. Okay? And general enrollment period and special enrollment period. Okay? And this is that 6-month Medigap open enrollment period. Now, let me hurry up and say this. When you're first eligible for your Part B, you also become eligible for a supplement. Now, if you do not sign up for your supplement within that 6-month window, because that's during that guaranteed issue period. You cannot be turned down, but that's a 6-month window. Beyond that 6-month window, you're subject to full underwriting. So for those who procrastinate, it's going to cost you. Okay? And we can talk more about that one-on-one. Currently, Part B, as I said, it's $99.90. This is actually tiered for income, and I think they need to really tweak this a little bit more because when you got people over here that's making $300,000 a year, $400,000 a year, and they're only paying $259, the same thing you're paying $100 for over here. I think that's an inequity. I think you're going to probably see some movement in these areas. Because a lot of things are being talked about as far as what they call quote-unquote entitlements. It's always intriguing to me when they want to call something an entitlement that I paid for. Social Security is not an entitlement. I paid for Social Security. We pay 7.65%. The employer matches with 7.65. 15.3 is being paid for something they're not calling an entitlement. Just because you mismanaged it, that doesn't make it right for you to go in and try to make some adjustments on it. Okay. Part C.